Hi, my name is Tilanka Munasinghe. Our paper is Socioeconomic and Geographic Variations that Impact the Spread of Malaria. My co-authors are Ayush Maheshwakar and Karan Banhot. Malaria is a preventable disease that brings death to millions of people around the world. Among the victims of malaria epidemic, children under the age of 5 are the most vulnerable. Malaria can influence where people live and work. In addition to the direct economic impact, malaria can cause indirect socioeconomic impacts as it affects the schooling, tourism, and sporting event. This epidemic has heavily impacted the developing countries, especially the ones that are in sub-Sahara region of Africa. During our study, we explored the data on 6 indicators used by United Nations and World Health Organization to evaluate the impact of malaria, and we explored the gross domestic product data from chosen 34 countries. We decided to use different clustering algorithms and compare the results. We applied unsupervised clustering algorithms like k-means, Birch, and other algorithms on a collection of countries to identify similarity between sparsely located countries based on any correlation between GDP value and confirmed number of deaths due to malaria. We decided to use the adjusted RAND indexed metric to compare the clusters from 4 algorithms. ARI is an evaluation metric that computes the similarities between the results of 2 clustering algorithms by considering all pairs in resultant labels. We calculated the ARI values for every pair of clustering algorithm, and the results are presented in this table. On comparing the clusters from the 4 algorithms we used, we observed that the k-means, Birch, and agglomerative clustering produce the most similar clusters, indicating by the high ARI values shown in the table. We used the elbow plot method to identify the suitable number of clusters on the k-means inertia value as shown in this figure. The possible values range between 7 and 8, and we decided to choose 6 clusters for our analysis. To gain in-depth understanding of the clusters of confirmed number of deaths due to malaria and their correlation with gross domestic product values of a country, we deployed k-means algorithm on the data for 34 countries across the years starting from 2000 to 2012. The clusters are colored in shades of red, where the darkest color indicate a higher mean confirmed number of deaths due to malaria. We observed 2 darkest groups in the middle of Africa, including Niger, Chad, Democratic Republic of Congo, indicating areas with high confirmed death due to malaria. On the other hand, Mexico, Kyrgyzstan have lighter shades due to lower number of confirmed deaths from malaria. Further, countries in South America like Bolivia, Brazil, and Peru have a moderate confirmed number of deaths due to malaria compared to other countries. In this figure, the cluster of 34 countries based on the mean GDP values across the years starting from 2000 to 2012. The darker the blue color shades, the higher the mean GDP value for the countries in the cluster. Brazil has the highest GDP value in the cluster, while other countries like Bolivia, Peru, and Argentina have relatively less GDP values. Countries in the middle and upper regions of Africa like Mali, Niger, and Chad have the lowest GDP values across the countries. In Africa, we see that the countries that have the lower mean GDP values, including Niger and Chad, have higher confirmed number of deaths due to malaria. In Brazil, Peru, and the GDP values are higher, but the confirmed number of deaths due to malaria are lower. The same correlation is also observed for Mexico. However, this one-to-one direct negative correlation does not exist for all countries. For Argentina, which is in South America, Democratic Republic of Congo, which is in Africa, the mean GDP values are relatively higher, but the confirmed number of deaths due to malaria are still higher, indicating that the other factors also contribute towards the number of deaths due to malaria in a country. During our study, we observed the negative relationship with number of deaths due to malaria and GDP. countries with a higher number of malaria cases have a lower GDP. This negative relationship indicates that the countries with strong economics can mitigate malaria's adverse conditions compared to countries with a lower GDP. Our code repository is publicly available at this URL. Thank you.